welcome. You're watching Medically Speaking. I am Meenakshi Upreti. Advanced infertility care, a word all of us have heard of but don't know much about. Do you know that June is celebrated every year across the world to create awareness around infertility? It's the World Infertility Awareness Month. Craving for a child, wanting to be a parent, that's something which everyone wants, everyone thinks of. It's a basic necessity. So why is it that there is so little awareness around it? How can we increase awareness around infertility? What are the issues which couples face, and what needs to be done really to resort the same? To discuss all of this and more, I'd like to welcome a panel of very special guests. First of all, I'm going to start with Dr. P.C. Mahapatra. He is the professor and senior gynecologist from Cuttack. He's the past president of FOXI. Also joining us is Dr. Pratap Kumar, head of the Department of Reproductive Medicine and Surgery from the Kasturba Medical College, Manipal Academy of Higher Education from Karnataka. He's also the past vice president of FOXI. Also joining us is Dr. Nandita Palshetkar. She's the president of ISAR, a member of FIGO HSSRC committee, past president of FOXI and IAGE. Also, she's a consultant at the and Har Krishnan Das Hospital in Mumbai, and also, of course, the Fortis Hospital in the national capital. Moving very quickly to our next guest, Dr. Rishma Pai, past president of FOXI, ISAR and IAGE. She's an assistant treasurer at IFFS, consultant at Jaslok, Hinduja and Leelavati Hospitals of Mumbai. Finally, but not the least, Dr. Rishikesh Pai, President-elect of FOXI, past president of ISAR and IAGE, Director Corporate Affairs of IFFS, consultant at Leelavati Hospital, also from Mumbai. Thank you all, first of all, for speaking to News. With Dr. Mahapatra. So, what really is infertility? What are the main causes which contribute to infertility in our country? And why do we need to create awareness around it? Dr. Mahapatra.
Yeah, thank you very much. I think the cause of infertility is well known, and from time immemorial it is there. But there is definitely a changing trends with the changing demography and socio-demographic changes in the society. There is really a change. So broadly, we divide the infertility, the causes into 1/3 of the female contributes, 1/3 the male contributes, and next 1/3 is both the partners contribute to them. As regards the exact pathology and the exact etiology is concerned, about the male, I think nowadays it's more of the gradual decline in sperm quality and the mortality, which has been contributed either absence of sperm, agiospermia, or the oligostenospermia. That's very important part in the male. Whereas in the female part, the tubal factor, the ovulatory factor, and the pelvic factor, the cervical factor, we teach the students. But for the clinicians, for the public awareness, I think the ovulatory infertility, the ovulation plays a great role in that. And with the changing situations now, we get a more number of cases of what is called a polycystic ovarian disease, and anovulation contributes to about 70% of the cases with that. Another important thing is endometriosis, which has come up in a big way because endoscopy has given rise to the diagnosis for that, and endometriosis is a definitely growing cause for infertility. Over and above, I must say that the female age is important. I think that's the awareness which we want to get. We are finding more nowadays with the declining ovarian discharge, and that is because of the female's age. The carrier syndrome women, late age of marriage, and I think a desire for childbearing in a late age. That is a very detrimental factor for the infertility, and that is the issue where the public should be sensitized that this is one of the very important determining factor, female's age. And we find now as before in compared to the previous decades, we are now finding more and more number of cases in elderly female presenting with the low ovarian discharge, and that's a very critical situation to manage also and disrupt.
Very Yes, sir. Age is extremely crucial and critical. We need to create awareness around infertility and age. So there is no doubt about that, sir. But when we speak about IUI, Dr. Pradeep Kumar, if you could jump in here, sir. When is IUI needed and what exactly is the process, sir?
Thank you very much. When a man has a low count, not too low, but around, the normal count is about 15 million per ml of semen. But if he has around, say, 10 million per ml, then we can put into the uterus the washed sperms when the woman ovulates. And that's called as intrauterine insemination. It's only done for maybe a short term infertility and not for too long infertility, because success rate is not pretty high. Success, if I do 100 cases in this month of IUI, 8 or 9 or 10 will become pregnant. Choose that intrauterine insemination for the right young couple whose husband is on the lower count. That's all. But you need to actually make her ovulate, get the right time of ovulation, and then the sperms are washed through some special procedures and media, and then we put the sperms into the uterus during ovulation.
Point taken, sir. And Dr. Palshetkar, if you could come in here, ma'am. All of us are talking now is about IVF. Well, there is some awareness around it. Perhaps we can credit body. That's like, but we don't know exactly what is IVF, what's the process. Simplify and explain it for our viewers, ma'am.
I think, Meenakshi, it's very important to understand IVF. Since this is Infertility Month and there are nearly 3,000 IVF centers in our country today, because it's very important to understand that IVF is one of the mainstays of the treatment of infertility. Today, if you don't get, treatment with IUI or simple drugs or with surgery, actually IVF can get you pregnant. IVF is simple. You take eggs, you take sperms, and you create a baby outside the body. The child or the embryo is actually created outside in an IVF laboratory. And this baby is then put back into the womb. So the baby grows for 9 months inside the uterus of the lady. So we just create the baby outside. And this process was actually discovered 44 years ago. 44 years ago, the first IVF baby was born. And since then, millions of babies have been born. And today, the success rate is nearly 70% if you do at least 3 times. See, Meenakshi, it's very important to understand that it's not a one-time treatment. When supposing you fail once, you must go for it second or third attempt, because young girls, women who have a good ovarian reserve, men who don't have very bad sperm counts, the very low sperm counts need more attempts, but a good moderate sperm count, all these people have a very good chance. They are known as good patients. The bad patients may require as high as 6 to 7 cycles of IVF. So it's very important to understand that IVF is a technology which is here to help people. It is very good success rates in young, and go for it young. It is very, very important. I think this message which Dr. Mahapatra said, that the age of the woman is very important because, people think IVF is the last treatment. No, nothing works, then we'll go for IVF. No, you have to go for IVF while you're young, because all the success rate, all the parameters depend on the age of the girl. So it's important, if you don't succeed with other treatments, please go for in vitro fertilization, which is just simple creation of the baby outside the body. You take 10 days injections. You do the monitoring with sonography. And the girl is admitted to the hospital. We get the eggs out with a simple procedure under anesthesia. So there's no pain at all. And the girl goes home within about 3-4 hours. So it's an OPD procedure. And the husband gives the sperms. So it's really
simple, very simple procedure. Perhaps it should not be looked at as a last ditch effort, which is how it's at in India. Dr. Pai, if you could come in here, sir. We speak a lot about male infertility issues, but very lack of awareness around the same. First, why do you think that is? And how do you treat couples who perhaps come to you and the issue there is male infertility?
So, as Dr. P.C. Mahapatra rightly said, 30 to 40% of people males are responsible for infertility. And that's why we always do a simple semen test when you are investigating the couple before. So first the man is investigated, and most of the time there is no reason for it. Sometimes there may be swelling of the vessels around the testis called varicocele, or sometimes there may be infection. Sometimes there may be a hormonal problem, and very rarely there is zero count. It's called azoospermia. So there are various causes of male infertility, and normally if the count is not very low, you can do 3-4 cycles of IUI, as Dr. Pratap Kumar has rightly said, and many of the mild male infertility patients, they become pregnant with IUI. If that fails, people can even go for IVF, as Dr. Nandita has said. But in very low count patients, IVF tends to fail. The fertilization fails, and that's why a new technique is there, which was invented in 1992, called intracytoplasmic sperm injection, where we take a sperm and inject it into the egg using a machine called a micromanipulator. So this totally changed the treatment for male infertility. And not only that, you can actually, suppose there's a zero count, we can put a needle in the testis, remove the sperm from the testis and inject them into the oocytes and create pregnancy. So with the advancement of ICSI, a major change has come in the treatment of male infertility. And we have now newer advanced techniques. In patients with repeated failure, you can do higher magnification, which is called IMSI, where you can magnify the sperm image 6,600 times and give better sperm. We have new techniques of harvesting the sperms called microfluidics or MAX. All this improve the selection of the sperms. Better sperms can be selected and better embryos can be created and better pregnancy rates can be achieved.
All right. And Dr. Rishma Pai, come in here, ma'am. What would you say? What are the third-party options, and when do you think they can be, couples can be advised for the same?
So there are many situations, unfortunately, where the couple cannot conceive using the woman's own eggs or the husband's sperm. And that is when a third individual is brought in to help them build their family. So today, many women are getting married late, or for some reason, they're not able to have a baby soon. Sometimes they're diagnosed with cancer, for example, and have to undergo chemotherapy or radiation, which damages their ovaries completely. Today, we're also seeing a lot of younger girls even in their 20s and 30s going into what we call premature ovarian failure or premature ovarian insufficiency. So even at a young age, the eggs become very less. So, or a patient has tried IVF many times and has failed. So in all these situations, you may need to borrow an egg from a younger individual. So this is called egg donation. And now we have good new laws coming in, the ART law coming in, which has given clear guidelines how this egg donation has to be done. Then again, in our country, it's common to have women suffering from tuberculosis of the uterus, damages the uterus completely. Some women are even born without a uterus, or some of them have to undergo many surgeries on the uterus because of fibroids or some diseases like adenomyosis. So their womb cannot carry the baby. As a result, they need to turn to a third individual who's a surrogate, who will carry their baby for them. So the baby belongs to the parents, who are the mother and the lady and her husband. The embryo is made from them, but it is deposited into another woman's womb to carry. That is called surrogacy. And the last thing which Dr. Pai spoke about, when sometimes the men have zero sperm, and even on biopsy, you get absolutely no sperms because of complete testicular failure. Then we can even borrow the semen from a semen bank, and we can use this to help the lady become pregnant through insemination or through IVF. So many occasions when we need to resort to a third party to help the couple achieve their dream of having
Right, but Dr. Mahapatra, what's the role of endoscopic surgery, sir, in infertility? Help us understand that.
Well, endoscopy is a very, very good diagnostic gadget for the evaluation of female infertility. And for that, starting from the diagnosis to the therapy, there are a lot of indications for endoscopic surgery. And diagnostic, particularly the hysteroscopy. We do the evaluation of the uterus cavity. You see the cavity of the uterus, and that's known as hysteroscopy. And when we do a laparoscopy and see the outside of the uterus and the pelvis, the ovary, the tube, whether there is any pathology, whether there is any endometriosis, whether there is any adhesions, all we can diagnose that. And nowadays, with the advances in the minimal invasive surgery, the benefits is well known to everybody. And that's why the minimal invasive surgery the hysteroscopic surgery as well as the laparoscopic surgery plays a very, very great role in fertility promotion. So there is a distinct advantage of the fertility promoting surgery, particularly in response to the adhesions, in response to the endometriosis. This is definitely a great role in therapy also, not only from the diagnosis.
So Dr. Pratap Kumar, sir, if you could come in here, help us understand, sir, how do you treat couples who face repeated IVF
very
failures,
good question, Meenakshi, because in this process of IVF, nothing is 100% because we are doing it artificially. And if the embryo is normal, it will implant. So generally, if the embryos are abnormal, it does not. So I think most of the time the embryo is defective and it doesn't implant into the uterus. Another reason is we need to have a very good protocol of getting the good eggs out of from the woman, and of course process the sperm very well and get good embryos. And recently I realized that there are some rejection factors in the body of a woman. That's why immunologically it can get rejected, because if she is deficient in her immunological status for some reason, it will not accept in the uterus. So I think the recurrent implantation failures are connected to the implantation process, which is still not well understood in the science. However, though we claim about 40 to 60% pregnancy, there will be recurrent implantation failure in some, and as Dr. Rishma Pai mentioned, there can be a damaged uterus because of some kind of infection, some kind of problems, and that is why it's important to have a very normal cavity in the uterus for us to get implantation.
Right. Dr. Palshetkar, ma'am, if you could come in here, we know a lot about the concept of fertility preservation. We've only been able to just mention it or touch upon it, but throw some light on the same. Help us understand exactly what it is, ma'am.
Fertility preservation is really now coming into the limelight. It's gaining a lot of importance because we are realizing that it is a very empowering technology. There are a lot of girls. In fact, today morning in the clinic, a 28-year-old walked in saying that I want to preserve my fertility. So I said, yeah, you're young, everything. We decided to test her, and her AMH, which shows us the ovarian reserve, was just 0.8. That means her ovaries were like a 40-year-old. So a 28-year-old came with an ovary of a 40-year-old woman. We are seeing this a lot. And this is what we need to really highlight and educate everybody, that please do the simple blood test, because what happens is that when these girls come to us for pregnancy later on, they have difficulty in conceiving. Not everybody has a problem, but majority of them have this problem. And all of us are facing, and as Rishma said during her talk, and then we have no option but to give them third-party, options like egg donation. So if they come early and they freeze the eggs when they're younger, when they have a good ovarian reserve, I think it really helps. So this young girl who is 28 and with a low AMH, I am still going to freeze eggs, because at a younger age, if you freeze 4 eggs, you get 1 normal baby. So even if I freeze about 8 to 10 eggs, it would be good enough for her. So this is what we are planning to do. So I think fertility preservation is important. It's here to stay. And not only for cancer patients, for patients of endometriosis, it's very important to, make people aware of it, because a lot of young girls, 15, 16, 17-year-old get endometriosis. People before marriages, they've not found the right partners. They're busy with their careers. Their girls are getting educated today and they're pushing their childbearing away. I think fertility preservation should be offered to this particular group of couples, where they can actually use this technology to enhance their lives. We use smartphones to improve our lives. Today, look at us. We are recording. We are all in different parts of the country. One is in the south, one is in the east, I'm in the west, you're in the north, and we are recording this program. So why not use technology to improve our...
fair point which you raise, ma'am. Use technology, end of the day, it's for our betterment. Everything really boils down to awareness. Dr. Pai, if you could come in here, since we are speaking of technology, Are you using artificial technology? Because everyone today is talking about AI. Is IVF, IUI, etc. also using or taking advantage of the artificial
So
technology
we are
available?
using artificial intelligence now. For example, if we are freezing eggs, we don't know how many eggs we should freeze. A young girl comes to you, you remove 8 eggs. Are they enough for the future? So we have a new technology where we can take the photo of the eggs before we freeze them, and the artificial intelligence computer tells us whether there are enough eggs or you need one more attempt and it need more eggs to freeze, so that she can get a good chance 10 years down the line. We also have artificial intelligence technologies to select the embryo, because what happens is, in order to have a higher chance of pregnancy, we put normally 2-3 embryos. So when we put 2-3 embryos, we get a better pregnancy rate, but in the process there is an increased incidence of multiple pregnancies. So you can nowadays take photographs of the blastocysts before you transfer them, and using artificial intelligence, you can, suppose there are 4 blastocysts, you can say, okay, this is the one which will give the highest chance of pregnancy, using AI technology. So all these new technologies are slowly coming in, and they are revolutionizing the treatment of IVF as we know it today.
Right. So the treatment of IVF being revolutionized, but Dr. Rishma Pai, can someone manage, say, genetic disorders via IVF?
Yes, in fact, that's one of the most important uses of IVF, even for people able to have a baby on their own without needing it. Because unfortunately, there are many prevalent common disorders, genetic disorders like thalassemia, all of us have heard about it, sickle cell disease, cystic fibrosis, Duchenne muscular dystrophy. And these are literally life-threatening conditions. And if somebody has a child born with a disorder like that, they definitely do not want to go through that trauma again. Or if the mother or the father is a carrier, they know that they have a thalassemia minor, and both of them have a thalassemia minor, their baby can have thalassemia major. So that can be a life-threatening condition. As a result, we now have very good techniques in IVF, very advanced techniques, whereby we can take the embryo with a laser, make a small cut on it, take a tiny piece of the embryo, like a blastomere biopsy or a day 5 embryo, we can take a small biopsy, and with the newer technologies, analyze these tiny bits of genetic material which we get, and we can determine through, we call it PGT-A or PGT-M or PGT-SR, or different technologies for different genetic diseases, and we can actually tell you that this embryo is normal. And many parts of the world today, they are doing only every embryo is tested, every blastocyst. So they grow the embryo to day 5, they test the embryo, and only one single normal, healthy baby is put back inside the womb. So the pregnancy rates are higher, multiple pregnancy rates are lower, and the baby is healthy because it has been tested. So these are the amazing new developments in IVF that have happened in the recent years.
Right. So, I've reached the fag end of the program. In fact, we are literally overshooting the time. But before I let you all go, I have one question. And it's a common complaint which people have against IVF. It's too expensive. How do you make it accessible to the masses? I don't have much time. Can I take one line answer from each of you? I'm going to start first of all, Dr. Mahapatra.
Well, thank you, Meenakshi, because from the beginning, when I started IVF, this was my main concern, because I'm practicing in an area where the people cannot afford. And that's why my low-cost IVF budget, I think that's the first priority of mine for that till today. Well, there are some things which you cannot do it. Now, the regulations which have come up, the ART bill and all that, I think the cost will certainly increase for that. And therefore, that is a real burden for us. We must change and all that and pressurize and to have some simplification of the steps. Second importance of the techniques also, we must reduce it. And the centers also, we should be more human than commercial. That's a very important speech for that.
Okay, point taken. Quickly, Dr. Kumar, one point if you would like to say. Any policy change which you would like to see?
Would be to reduce the cost of the drugs by changing the combination of medication like tablets and injections can be done, because we otherwise only use the injections all the time. So there can be reduction of the cost, and also not to do unnecessary investigations to increase the price.
Dr. Palshetkar, what would be your suggestion? In fact, I think I'd really like one suggestion you gave. If women could just do a simple blood test and check their AMH level, it's so simple. No awareness around it.
Absolutely. That is something that is very close to my heart, and that is what I'm propagating this year as a president of ISAR. But what I would like to do is, we have started this empathy fund from our organization where we would request all the IVF centers to actually do, when Dr. Pai was the president, we would like to do 2 free IVFs per month with each of the IVF centers. So this is something we're doing voluntarily. Every IVF center does voluntary. So we should take we should do it on our own, that we reduce the cost and we do budget IVFs. Everybody is doing budget IVF. Trust me. Everybody is doing budget
All
IVFs.
right. And Dr. Pai, would you like to add your 2 bits here?
Oh, me? Yeah, no, definitely. I feel that we don't want a single patient who needs IVF to go away without getting that facility. And so each one of us, I think, we offer the lowest cost treatment. We cut down on the drugs. We do different new modifications have come in where you can replace injections with tablets, which are very, very cheap. So be updated with the latest medical advances. Use them for low resource settings. And I think we never turn away a patient because she's poor.
And Dr. Rishikesh Pai, final word to you, sir. What do you, in your opinion, how do you make IVF accessible to the
we
masses?
have to request our central government, our Prime Minister and our state governments to bring IVF under Ayushman Bharat scheme and insurance covers. It's very important. A lot of people, nearly 800 million people in our country are very non-affording, and we must help them by getting them under some kind of insurance scheme.
Why not? Why is it that we treat or have a stepmotherly treatment when it comes to infertility? It can be life-changing for a couple. It can be a priority for some. End of the day, it's an individual decision. You've all shared, of course, some valuable input and some extremely great and futuristic suggestions. I do hope someone in the administration is listening and some of these, suggestions which you all have given are implemented. On that note, I'd like to thank all our guests for joining us on the broadcast. On that note, it's a wrap on the bulletin.
Thank you.
Thank you. Thank you, Meenakshi.
Thank you.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.